Number 10. A New York Times investigation shows that a growing number of patients are being pushed towards organ retrieval while they're still alive or showing clear signs of consciousness. Central to this issue is the rise in organ harvesting after circulatory death. The patients are on life support, usually in a coma, and unlike brain-dead patients, have a remote chance of regaining consciousness. Once families agree to take their loved ones off life support and circulatory death is declared, harvesting can begin. Families report loved ones crying, gasping, or blinking during preparations during donation. In New Mexico, a woman fully recovered after her organs were nearly taken. In Kentucky, a man awoke just before life support was being withdrawn. And in Alabama, Misty Hawkins was cut open for organ removal, only for surgeons to realize that her heart was still beating. Number 9. The Oxford Center, an alternative medicine facility in Troy, Michigan, was using a hyperbaric oxygen chamber for dozens of unapproved conditions, like Alzheimer's disease, autism, and dyslexia, or in the case of patient Thomas Cooper, age 5, ADHD and sleep apnea. A tragic malfunction during Thomas's treatment, when no doctor or licensed technician was on site, led to him becoming engulfed in flames and dying an instantaneous death. According to an investigation by the Michigan Attorney General, a grounding strap, a basic but critical tool to prevent static electricity, had not been used and was later found in a quote-unquote junk drawer. 4 people were arrested. 3 were charged with second-degree murder, and 1 was charged with involuntary manslaughter. The family has filed a $100 million lawsuit. Number 8. According to an investigation by The Guardian, United Health Group, the nation's largest healthcare conglomerate, created a financial incentive system that rewarded facilities for keeping sick patients out of the hospital. Teams of United Health employees were even stationed in some nursing homes, enabling them to exert influence over care decisions. One man experiencing a stroke now lives with permanent brain damage after his hospitalization was postponed. Staff also reported being encouraged to talk to residents about changing their code status to DNR to reduce expensive end-of-life care. Number 7. Chesapeake Regional Healthcare is accused of enabling OBGYN Javid Parwaiz as he pushed women into the OR with false cancer diagnoses, induced births without cause, violated consent rules for sterilization. Meanwhile, the hospital was billing patients for $18.5 million. Parwaiz has been convicted for his crimes and is serving a 59-year sentence, but now federal prosecutors are after the hospital for its role. Leaders are accused of ignoring warnings about Parwaiz, including his 1995 conviction for a tax fraud case, for claiming a Ferrari as a business expense, amongst other charges. Number 6. Adriana Smith, a 30-year-old Atlanta nurse, was 9 weeks pregnant when she was rushed to Emory University Hospital Midtown. Doctors found multiple blood clots in her head and were unable to act in time to save her. The hospital kept her body on life support even though she was brain dead. They believe the state's personhood law, which grants a fetus full rights if it has a detectable heartbeat, required them to keep her body functioning until the fetus became viable. 4 months later, the baby was removed via emergency C-section and survived. Smith died 4 days later when she was taken off life support. Number 5. A Boston Globe Spotlight investigation shows that for more than a decade, Dr. Derek Todd, a celebrated rheumatologist in Massachusetts, allegedly sexually abused some 250 patients while the institutions he was employed at looked the other way. Many of the offenses occurred at the Harvard-affiliated Brigham and Women's Hospital. Even after physicians reported disturbing allegations, Todd was allowed to keep seeing patients for months and perform exams that he had been told to stop doing. In addition to hundreds of civil lawsuits, Todd now faces 2 criminal rape charges, to which he has pleaded not guilty. Number 4. Despite little evidence showing that they outperform traditional bandages, more than 100 new, quote, skin substitute wound care products have come to market. And the average cost of 1-inch square skin substitute in April 2025 was nearly $6,000. Due to a loophole in pricing rules, for the first 6 months, Medicare reimburses these products at whatever price the company chooses. Spending on these bandages exploded to more than $10 billion in 2024. This is more than what Medicare pays for anesthesia or CT scans. Meanwhile, patients harmed by sloppy and indiscriminate application have landed in the hospital with infection, sepsis, amputations, and in at least one case, death. Number 3. Biotech company Humacyte promoted its lab-grown blood vessel as a breakthrough for wounded patients. but its research didn't hold up to scrutiny. At the FDA, scientists saw questionable data, failed safety checks, and vessels that could rupture without warning. Yet FDA leaders approved the product anyway. Agency staff raised the alarm, and one even resigned in protest, calling the risk to patients unacceptable. Selling for nearly $30,000 each, these vessels are being marketed to hospitals and the US military as a treatment for soldiers who are injured on the battlefield. Number 2. The job of institutional review boards, or IRBs, is to review clinical trial protocol to ensure that trials are conducted ethically. However, private equity firms with connections to drug companies are increasingly buying IRBs, along with the companies that design and run the trials. For example, Novo Nordisk hired WCG Clinical, an IRB partly owned by Novo's own parent company. Since that investment, WCG has been picked at least 46 times to review Novo trials. At WCG, more money now comes from helping drug companies run studies rather than safeguarding the patients in them. Number 1. Since Robert F. Kennedy has taken charge at U.S. Health and Human Services, he's made claims that have potentially far-reaching consequences for Americans, including promoting a long-debunked link between acetaminophen use during pregnancy and autism. A few weeks after he publicly made this claim, Kennedy doubled down, citing unreviewed, unpublished, and unsupported studies that infants who have circumcision have double the rates of autism because they likely receive acetaminophen as a pain reliever. By late October, the highest health official in the land had walked much of this back, admitting the association was suggestive, not causative. But the damage has already been done.